Hello, my name is Ken Cutbush. I'm an orthopaedic shoulder surgeon working in Brisbane. I'd like to talk to you about reverse total shoulder replacements. Specifically, I'd like to talk to you about the risks and complications that you need to think of and take into consideration when planning to go ahead with a reverse shoulder replacement. Now, this is a substantial operation. It's like a hip or a knee replacement. It's an open operation. And like a hip or a knee replacement, there are risks that you need to think of in terms of the surgery. So there's a risk of infection. That's less than 1% for reverse shoulder replacement. In my practice, the risk of infection is much less than 1%, but it's certainly still there. Infection is significant. If the infection is bad, it may even mean that the prosthesis has to come out and put back in. So it's not something to be taken lightly. Nerve injury is a possibility. It's rare. Normally, if there is any issues with the nerves, they're just a bit of bruising. The nerves will recover quite quickly, but that is something you do need to consider. Risks of haematomas and DVTs and wound problems, all of those things can happen, of course, and you need to be aware of that. And there is the risk of dislocation. For reverse prosthesis, the risk of dislocation tends to occur in the first year post-operatively and runs about 1% in the Australian Joint Registry. My experience with the risk of dislocation following reverse is less than 1%, but it is still there and something to think of. If you do get a shoulder that's popping out and it's unstable and dislocating, it may mean that you need to go back to theatre and have the tension of the prosthesis increased. What we do is take some of the parts of the prosthesis out and swap in bigger or longer pieces that actually increase the tension there and increase the stability of the joint. The other thing to think about is the anaesthetic. This is a substantial operation and it's like a stress on your body or a stress test, and so we want to be sure that any medical problems or issues have been identified preoperatively, and to that end we get to see a physician before the surgery to make sure that you're as fit and healthy and ready for the surgery as can be. So risks of the anaesthetic, I think that is something I think that everyone in Australia is aware of, that there are risks from the anaesthetic, and that does need to be considered.